or good evening. I am Susana. I'm a physiotherapist. I'm from Brazil, and I'm master in neurology. So what I'm going to present is a clinical case study of possible, that's what I want to discuss, a possible COVID-19 sequelae or associated disease. So I'll introduce what I found some sayings of Oliver Sacks and Vilensky for 2005. It was the time of the bird flu virus, if you remember. That ended up not being such an epidemic, but what he said was, if the flu comes, if it comes, may bring more than influenza. The influenza pandemic of 1918 was followed by another epidemic. This disease was encephalitis lethargica, the sleepy sickness. And like influenza, it spread through most of the world. What I want to pay attention now, the symptoms. Most commonly, there was lethargy, but sometimes there was insomnia, frenzy, and paralysis, and sometimes mental disorders. Okay, that you should keep in mind while we follow. So, case description. The setting was, I have to explain earlier, the setting was a public health facility here in Brazil, São Paulo. The public health facility was is a joint venture of social support and health support, and it has many of these facilities, and this facility is built and works only for 60 and plus older people. So it is a place where there are a lot of activities during the day, and I was a preceptor with the students in that place. So we came upon this patient. This patient of mine, of the center, Mr. OMT, was a male, 69 years old, otherwise healthy, performed walking with his wife 30 minutes a day, 5 days a week. Otherwise healthy. Then he tested for COVID-19 in March 2021 with mild symptoms, loss of taste, and coryza. In Brazil, we had a delay in vaccine, so he had not been vaccinated yet. 2 weeks later, he was vaccinated, showed no side effects. The following day, as the families reported, woke up, and description was the psychic breakout. Did not want to eat, not want to get out of the bed, to clean himself. So the family took him to a general hospital, was admitted and stayed there for 30 days for trying to find a diagnosis. And the diagnosis was depression, okay. And he was losing weight. Then he was transferred to a psychiatric hospital or all of public care, where he stayed for more 30 days, and he started to improve. recovered weight, accepting food, self-hygiene, but they still had this characteristic of avoiding contacts with sons and family, grandson. Then he went home. Still very thin and very isolated. Then started to present behavior alterations, such as hallucinations. She didn't really tell me what exactly were these hallucinations, and still had depressive symptoms, and was followed up by a psychiatrist. And then after that, started to present also resting tremor, then was evaluated by a neurologist. Then a PET scan showed hypermetabolism involving frontal, parietal, temporal, and occipital lobe. And it was hypothesized Lewy body syndrome. There was his hypothesis. Okay. The medications on use were, when we evaluated him, was November 2021. It was an antipsychotic. It was a medication used in Brazil for Alzheimer's, and another, the Prolopa, for Parkinson. It was a mix of many medications. As we can see, the medications kept him in control, but he still didn't want to engage in social activities. So the wife took him to the social and healthy support facility to see if he started to improve and engage in activities and engage in social life again. There was the idea. Well, during the evaluation, he would
Dr.
barely
Susan,
talk.
sorry for disturbance, but your slides are not moving. I can see your first slide only.
Sorry?
I can see only your first slide till now. The slides are not moving. Are you still on first slide?
So now can you see?
No, it's still stagnant. Can you stop once and try to share again? So it will be visible, I guess.
So I'll start with the one now. Okay, can you see now?
Yeah, I can see your slides now. Thanks. You can carry on.
Okay. So during the evaluation, he would barely talk. The wife told us that she had to force him to get out of bed, eat, dress up, but he had the ability to move and stand on his own, but with a major risk of falling, because he couldn't stand on 1 feet. But he did not want to stand, or not didn't want to be examined. When talking to him, he said that he had no favorite food, no favorite activity, and liked to sit in his house and do nothing. And he didn't remember, he didn't know the day we were, he didn't know the place he was, he did not remember his birthday, told he had no more sons, but his wife told us he had 4 sons, and they all helped to take care of him. He took a few steps this day and analyzed his walking. They showed no alterations of balance and rate of motion, comparing to the same people of his age. So no alterations in breathing. Muscle strength seemed normal. A little bit of resting tremor, mainly in right hand, but also in right foot. And what he'd like to say often was, I don't have any pain. There's nothing wrong with me because I don't have any pain. And this is what he told us. And primarily, he had no favorite activity and no interest at all. So it took us like 3 weeks to convince him to do this next videos that I'm trying to show you. I hope you can see. I'm going to explain first, and then. So this is the facility. This was an exercise that you were supposed to put like a square and walk front and left and back and right, like if you're drawing a square in the floor. This is our patient, blue. This is his wife, and there was what happened. He did not have the motion control to perform the activity. Much unlike the others. This next video was an exercise that was carried on by a folkloric Brazilian song that we all learn as a child. And the song says what you're supposed to do, the movements. And then what I want to show you, let me show you the video. So even though everyone else was dancing, he could look at everyone else. Even though the music said the movement he was supposed to do, then he would show this lethargy, as you can see. What I want to show you right now is he's trying to So he has improved a little, but we can see he has this lethargy. What I want to show you now is that he had no rigidity. So it's this one, okay? See, he had no rigidity, no alterations in range of movement. So I searched the literature about long COVID evidences in neurologic findings, and this paper showed cases showing many neurologic disorders after COVID-19. So we all know that COVID-19 can affect the brain, can affect the nervous system, but we don't know yet how. We don't know yet the mechanism because it's a new disease. Then I searched the literature in epidemiology. There is this large 6-month neurological and psychiatric outcomes in survivors of COVID-19. And now I want to discuss only the non-hospitalized patients that had mild disease. This large cohort study analyzed several diseases of neurologic interest and psychiatry outcomes. So what I concluded based on this neurologic cohort study is that this kind of outcome, neurologic outcome, seems very, very rare after COVID-19. If you compare, for instance, to anxiety, it shows a larger number. So encephalitis, only 95 people of all this number, 119,000 people. So I searched the literature for what my colleagues of physiotherapy have been doing. Then I searched PubMed, and there was no specific literature. Then I searched our Pedro. There is the physiotherapy evidence, high evidence network. And all I could find, it was physiotherapy focused on ICU patients with respiratory, cardiovascular, and muscular rehabilitation. That's what I could find. So I have more questions, like all of us, about COVID-19. My question now is, the today known as long COVID might be this case? I don't know, but I was thinking, Lewy body disease is a long run neurodegenerative disorder, but the patient improved in motor skills and independence in daily activity, including, according to the wife, Parkinson's can slow down movements, but he had not this characteristic as presented on the videos. The memory did not improve, but the willingness to engage in exercise and social activities did improve. And he did maintain his allegation every time he went there. Oh, I am perfect, fine. There's absolutely nothing wrong with me because I have no pain. But as the follow-up I have is only by December 2021. He was still avoiding contact with the sons, with the family and grandsons. What I was thinking about this is that if you have a mild COVID-19 case, maybe you have not gone after a follow-up. Maybe general clinicians around the world are not making the link between those neurological distress or disorder and COVID-19. Maybe we cannot really have data because we have emergency. So of course we were worried about people dying in hospitals. But as I see now, the scientific community and all the fellows of all the multidisciplinary team in healthcare should be aware of this possibility that COVID-19 might be causing neurological and psychiatric disorders. I was remembering in Brazil, and when the Zika virus came out, that suddenly a rare event of microcephaly started to pop up. And then was Guillain-Barré syndrome. That used to be a very rare disease, started to pop up also here in Brazil. The Zika virus is transmitted to mosquitoes bite. So we had a lot of those cases. And I believe there should be awareness, and there should be more scientific approach and researches about this, and people should all try to link. But I am open to discussions, and open to opinions, and I'm open to questions if you have any. I want to thank you, Kevin, for the opportunity to participate in this forum. Thank you.
Thank you so much for your presentation. Now floor is open for the questions. If anyone have. Anyone having the questions?